Hi, Bill. How are you doing?
I'm doing great. How are you, Susan?
Yeah, good, good. Yeah, I think we have the end of the year rush with the health expenditure report, which was just launched yesterday. So
Oh, congratulations.
yeah, thank
Congratulations.
you. Thank you. And we have a chapter on COVID, which is challenging because of the expenditure data is from 2018. So we have new macro fiscal data and budget data that was collected. So it was interesting. It was interesting. But speaking of common goods, of global public goods, right? uh,
Exactly.
yeah, yeah. And how is the new role going for you? Good.
So at the IDB, we also have a kind of end of year rush with a lot of projects being approved. Actually, I just saw Bahamas just got a loan approved to handle COVID-19. So that's
Yeah.
one of the, and now that the vaccines are beginning to be coming out with efficacy and safety, we're rolling into this process of trying to figure out the regulatory issues that are coming up and the deployment plans that countries are going to
Mm.
have to put together. So there's
Yeah,
quite a
of
lot to do
course.
to
Yeah, the
make it all happen.
details. Yeah, exactly, exactly. Yeah.
But it's
Um,
very apropos of the conversation we were going to have today about common goods for health, because vaccines, research and development for vaccines, disease surveillance, I mean, everything about COVID-19 is just about a perfect example of a common good for health, right?
yeah, absolutely. The regulatory environment, all the accountability mechanisms. Yeah, absolutely. I think for us, it's been um, quite striking because, of course, this program of work started in as kind of a warning bell and trying to really place these common goods as part of as step zero of UHC, right? That there was this concern that there was this rush towards thinking about interventions and services, and maybe not about enough about the enabling environment, the foundations, the policy, the legislation, the coordination, the surveillance systems, the labs, the water and sanitation services, and now we're seeing it all come together. And I think also for me, one of the areas of this program of work is seeing, because it was framed as the foundation for health security, but also looking at the environmental issues, looking at the issues of NCDs and comorbidities, looking at the issues of infectious diseases. And what we're seeing with COVID-19 is really a convergence really across those three issues, and how interrelated uh, these risks really are, uh, and
It's
so
really
quite
true.
striking.
Yeah. I was thinking back when you first contacted me about when we published these papers and then launched them in, was it September last fall?
Yeah, September, exactly.
Yeah. So, it was only 3 or 4 months before the COVID pandemic started.
Yeah,
And there,
yeah,
I remember people talking about, SARS-1 and Zika and the other things that had come before, and having this feeling that there's this urgency for this
yeah,
kind of investment. And yet, and it isn't that expensive. I remember, what was it? David Peters' paper talks about amounts that
yes.
are on the order of $4 per capita to cover a lot of these, just $4 per capita to cover what are essential services, which would have helped any country today to have handled the COVID-19 pandemic much better than they have.
Yeah, completely. No, I'm just looking back at the introduction to the special issue, and it talks about all these paradoxical challenges that on the one hand you're seeing all this progress and growth, but on the other hand there was this real concern amongst everybody working on these issues, and far beyond our group, about just the real gaps in terms of the foundations, and a lack of action. And I think what's been interesting in terms of how we've been working on the common goods for health agenda since COVID, right? Is that for me, the market failure part of common goods for health is built in. that we know that this is central, this is a public financing agenda. The private sector isn't going to come in and start funding regulatory systems necessarily, or water and sanitation systems necessarily, or surveillance and the research and development, that this is a public financing agenda. But the flip side, of course, of the kind of public good is the collective action failure. I mean, that's also baked in terms of citizen demand, in terms of how political leaders take action, what are their incentives to really prioritize not just investments, but also actions. And I think that for all of us, in thinking about that particular challenge, particularly in light of this idea that these are supposed to be affordable, we do keep coming back to your paper. We do keep coming back to this question of, why do societies ever invest in common goods for health? Okay, if there's a market failure, if there are collective action failures, but there has been progress in certain areas. And so I think that's where we were so excited to be able to talk to you, because you've thought about that part of the story in terms of what leads to action, why, even from a historical perspective, what can be done, what can we learn from the past that can help inform actions for today. And
Yeah.
I thought that would be great to
That's
hear your reflections, particularly given these changes as well.
yeah. It's I mean, what you said is essentially what I remember getting into this project and reading the economic justifications, the technical justifications, and that was essentially the comment that I made was this issue of the political side of what does or does not lead to investments in these things. And it's funny because looking back, I mean, there were three things I remember in that commentary. I think there were three things that I emphasized. One was that you get common goods when people have a sense of being a collective entity, right? So if everybody's thinking just of their own family or ethnic group or a small village, I mean, over history, we've developed different identities as societies. And the idea of a nation state is actually quite recent. Who's French is like 2 centuries old at most. Again, that's even for old nations, not just new nations like the US. And what makes somebody in New York feel like they have a commitment to do something like invest in a CDC that's not just for them, but also for people in Los Angeles and Wisconsin and wherever. And so it seemed to me one of the first things that has to happen for people to invest in these kinds of common goods for health is they have to think that they have interests in common. It has to be a collective entity of some kind. And that's not just politically like a country, it's also a sense of affinity. And what I think has happened, I mean, the downside of what we've seen in the last 10 years is a lot of polarization in many countries. I'm working in Latin America right now. There's a lot of countries there's a lot of polarization that's happening in society. And it's hard to pull people together when that's happening in other spheres. The positive side is when you do see countries pulling together. There's cases where parties that never talked to each other before are actually sitting down and coming out with plans. So that sense of collectivity is really critical to it. The second part of it is the salience. Is this an issue that you can really bring to people's attention? And I think the example I used in the paper was sanitation in the 19th century. And in urban areas, cholera was a very scary thing, but it was very present in the dense areas of cities. You could smell it, you could see it, and the rich sort of removed themselves from it. But at a certain point, even they couldn't ignore it. And so the salience of something is really important. And in September last year, pandemics were not very salient. And the fact that COVID-19 has done such devastation around the world, to me is, again, it's it's a hopeful sign if countries respond to this by saying, oh my gosh, we really have to invest in these common goods for health, because otherwise the whole global economy can get shut down. And then the last part was the role of elites. And it's often uncomfortable. People talk about the elite side of this and the differences between elites and popular interests. Citizen demands are important, but historically, it's the elites who've decided whether or not we're going to invest in common goods for health. And for that to happen, they have to have a sense that it's in their interest. And going back to the sanitation example in the urban areas in the 19th century, there was a point at which both the cost of putting sanitation in had declined, and the elites started thinking of their cities as something that they wanted to be living in modern cities. And they partly they couldn't get away from the pestilent areas anymore because of the scale and the density. And partly it was, this is what a modern city is. And they started seeing Paris and London do that, and then it became the norm that public investment in sanitation was an essential part of a commonly financed. And it's also, sometimes it's not that we need the elites to finance in it, we just need them to support it. Mm-hmm. So there are elites who have opposed common goods for health. They don't, I'm thinking of issues like climate change, which is a whole another longer term crisis that we're in the middle of. But if elites at least support the taxes on the middle class to pay for these things, we can get them. So it's those three things: thinking of ourselves as a common group, the salience of the issue, and then elite interest. And I think this is it's a desperate time in many ways because of the disease, but I couldn't have imagined anything more powerful to get across the sense that we're all in this together, mm-hmm. that it's a big issue when it happens, and that elites have as much of an interest as anyone in making sure that we're prepared for the next one.
Yeah. No, this is one of the takeaways from the work, is that for me, it's about generating that citizen demand. And I think even broader kind of societally, it's been interesting because I've heard some commentary about, even despite this swing towards populism, you've seen a lot more civic engagement. I mean, you've obviously, we're both Americans, and so we saw this in the recent election, but we've also seen it through the Women's March, the Black Lives Matter, that people taking to the streets and feeling that need to give voice. But then I think also this point about the importance of engaging the politicians, the people who are really, because the regulatory function of the state, and particularly if we think about what's in federal states, that coordination function, these are things that you aren't necessarily going to get citizen demand on the streets for, but they're really critical functions. And so how you have that engagement of the social participation side, but also the political engagement and the politicians and the elites, and how you forge those coalitions in a really powerful and meaningful way, I think for me is an area that I think seems particularly critical in terms of how we come out of this. Obviously there's also the community part of this, how we treat one another. And I think that's where I think a lot of work is going to have to be done, right? Because the one thing this has done is taken us all apart from our communities. And so how we then come back together again, and I think it'll be hopeful. I think that people are craving that. I'm certainly craving that.
Yeah, I guess that there's as you're talking, I'm thinking about two different sides to this. One is the community engagement, which, for example, the response to Ebola the community engagement was probably 90%. That's an exaggeration. I don't know what the percentage would be. It was a huge part of their ability to eventually pull that closed. It's not that a vaccine appeared or anything else. It was really the social behaviors that were critical. And it's in this, and with COVID-19 as well. And if you look at places like Melbourne, I was just reading, they're down to 0 cases. They did that without a vaccine. And it's partly, I think a huge part of it is that is the social response, is engaging people in a collaborative effort to reduce transmission by wearing masks, by social distancing, by giving up on bars, but making sure kids can get to preschool. I mean, there's a whole aspect to that thing. And it's powerful. It's hugely powerful in public health. The other side, though, is the parts where you really need a state. And I'm thinking about the centers of disease control. I'm thinking of the people who can actually, do a diagnostic and find out somebody's sick and then trace the contacts, approach them appropriately, ask them to self-isolate. All the data processing, the diagnostic laboratory work, the investments that no community is going to do on its own or even know how to. And so it's really both sides of the picture. You need this community engagement, which can do a huge amount, but we can do so much more when we also have capable states that are willing to invest in certain basic, really basic, but very important research, data, infrastructure.
Yeah, absolutely. And taking a longer term perspective beyond the short-term election cycle, right? I think that's part of it too, is how do you work beyond that in terms of the policymaking process? And so, but I hopefully that's through the voting cycle and real citizen demand for leadership in that way. I think, anyway, I think for me, as far 2020 has been incredibly challenging, but I think it's taken us, I mean, it's a global stock taking individually within our own little nuclear families, within our societies, within our school communities. And so
that's really true. And if you had told me when we were talking in September last year that I would know what WHO pre-qualification of vaccines was by the end of 2020, I thought, no, that is not a detail that I'm going to pay attention to. But the work program that I developed with the IDP back in January 2020 is not the work program I did this year at all.
No.
And I think that there's a lot of people I mean, for me, the work's been directly on COVID-19, but for other people, as you say, it's been how do we change the way we work? How do we change the way we interact with family? And places that have really accomplished this well, it should be an incredible matter of pride.
Yeah.
And I think societies, I just don't know how to put it. It's like we need to learn, individuals need to learn through their lives. You become wiser as you get older, hopefully.
Let's hope.
And the question, I guess, back to the commentary, I think the reason I really wanted to get that historical perspective was to say we need to remember things back even 200 years that would help us recognize this moment is a historical moment that we should be learning from for the next 10 and 20.